the bladder and the uterus sit right here together, okay? But as my bladder fills up, okay, it's gonna make my uterus lay flat, okay? So that way my ultrasound is hitting it more at a 90 degrees, because when it hits like this and hits it at 90 degrees, I'm gonna get artifact. And I'm not going to be able to see the lower part or the lower uterine segment of my uterus because of the way ultrasound interacts with the body. We want the bladder to be full so it lays down my uterus, so that way I can see the anatomy better. Oops, sorry. You can straighten it out. Okay? Okay, we're also going to learn why it's important for you to be registered. Okay? When you are registered, you are confirming your radiologist, other sonographers, and your patients that you know what you're doing. Okay? I never have an exam that I don't ask them if they're registered. Ever. Ever. Never. Never, 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 never. Okay? Because I have worked through the field. I've been in the field since 1979. And with ultrasound, it's still on-the-job training at some places. Okay? Yes, those people have a lot of experience. They might have 35 years of experience. But I had 25 years of experience before I ever went back to school, because I knew I didn't know enough to pass the registry. So I went back to school because I did ultrasound from 1979 to 1995 without a license. I can't even imagine how much pathology I missed during that time because I didn't know what I was doing. I felt like I knew what I was doing, but then when I went back to school, I realized how much I didn't know. Okay? And it's my right to have any of you decline. Like, hi, my name is Georgette. I'm your sonography student. Do you mind if I scan? Hell no, I don't want you to scan me. You know, but being from a teaching hospital, if they're a student, I always let them scan. Okay? But I usually say, oh, so where'd you go to school? Oh, I learned mine in the Navy. You learned how to do ultrasound in the Navy? Is there another sonographer that can work on me? No, I'm the only one. Then I'll reschedule. That's my right. A patient does not have to let you do them. They don't have to let anybody do them, because there's different religions where women can't be scanned by men. And so what happens is, if you have a man on call and they come through the emergency room, if it's an emergent thing and a man's on duty and the patient refuses, then they have to call their manager to get a female out there. And usually, if the manager's female, then she will come. Okay? If not, then they just have to wait until the female gets there in the next shift.
You say using a 3.5 transducer?
A 3.5 is the most prominent transducer. A 3.5 megahertz. But if I have a little bitty skinny person, I'm going to use the highest transducer that I can use. Like if I go up to the neonatal unit to do a pelvic exam, because my patient has an ambiguous genitalia. They don't know if it's a male or a female. And I'm going to use a really, really high frequency transducer. And we're also going to talk about why it's important that the sonography department is accredited. Okay, so when I do the exam, when you go into the machine, you're going to hit new exam, and then you're going to choose your patient from a list. Now they're going to start explaining this to you tomorrow. Okay, so by tomorrow afternoon you get off, you're already going to know how to populate your patients. Be sure you choose the right patient, because if you choose the wrong patient and that exam goes on to a different patient, they call that a red flag or a red door.
Red rule.
Or what?
Red rule.
Yeah. And then you'll be written up for that. Okay? That is a major, major, major infraction. Okay? So be sure you check the information on your requisition along with the information that's going to be on your screen. A lot of places you'll have manual. You won't have a PACS unit. And you'll have to manually, like we do here in the lab. When we put it here in the lab, we usually use the scanners as the patient. So that way we know as instructors who's doing what. Okay? Okay, so this is some of the information that is going to be on the screen whenever you do. You have your patient name and your patient ID. Your patient ID is usually going to be the medical record number, okay? Some places will use the accession number. That is the number that goes with that exam, okay? Like if I do a transabdominal and a transvaginal exam, both of those are going to have two different accession numbers. Okay? So this would probably be the medical record number. This would be the accession number. And you're going to put your sonographer's initials / your initials. Okay? Their date of birth is already going to be there. Last known menstrual period is the very first day that they bled previously. It's the very first day that they started bleeding. Okay? Estimated day of delivery or estimated day of confinement. Sometimes it'll say EDC. That will tell you about when the patient is going to be due if she is pregnant. Okay? The gravida, the para, and the abortions. So she has had 2 pregnancies. She's had 1 to term. And she's had no abortions. So what's going on here? She's pregnant. Okay? Okay, so she's pregnant, she's delivered 1, and then she's had no abortions. Okay? And then the referring physician, that will be part of the program that comes up. So you're going to introduce yourself, you're going to identify the patient, and you do that by asking them their full name, their date of birth, what exam they're there for, to make sure that you and the patient are on the same page. Okay, that you and the patient are on the same page. And you're saying, oh, I see Dr. Ali is going to do an exam of your pelvis today. It says here that you're having right lower quadrant pain. Is that correct? She goes, no, my pain's up here. So what's happened? They've ordered the wrong exam. It's just a push of a button, and it happens. But as sonographers, we are the last one to catch that mistake. Okay? So if we think that the wrong exam, then we go ahead and make the patient comfortable. I don't undress them yet. And I take my paperwork to the front desk and say, I think the wrong exam, could you contact the doctor? I'm not going to put my patient back out into the waiting area. Okay? Now, some facilities will, so you'll have to find out how their protocol works. Okay? If it's a house patient, I'm going to look at their armband. I'm going to make sure that they are who they say they are. A lot of times you'll say, Georgette Shepherd, and 3 people will stand up. That's unusual, right? But I'm not going to say. one of you's wrong, or two of you are wrong, you know. I'm gonna go around and I'm gonna check each one of their armbands. Or I'm gonna have them show me a picture ID. Okay, being at the Harris Health System. Okay, so this is what it is. I always ask my patients for a picture ID. Because what happens is they share insurance. Well, that's insurance fraud. Okay? So find out what your facility needs for you to do for your 2 patient identifiers. Okay? Because I know when they check in, if they don't have a picture ID, we don't do them. So a lot of facilities, they've already checked that picture ID by the time they get to us. Okay? But I might work at somewhere else, and the only thing is the front desk and me, and then that's it. Okay? So I've got to make sure that there's no insurance fraud.
What if they are twins? Oh, we can.
Twins?
Yeah.
That won't matter to me. They're gonna have their own ID.
I mean, there's no sign in the ID.
They're not gonna have the same name.
Just,
Because you're gonna do twins.
Yeah, yeah.
So
Up in the
it's not
NICU, you're gonna do twins. I check the armbands.
Mm,
You'll never have an outpatient twin come through,
yeah,
but you're gonna do twins inside the hospital.
yeah.
And you're gonna do the armband.
Asking twin patient, for example,
Yeah.
my sister comes in for me and says she's born.
Yeah, that's how come I asked for your ID.
But we're twins.
Yeah,
Twins.
yeah,
Send
they're
date-
gonna check the ID.
We're gonna
They
let
send
him
date of birth.
Yeah, you're gonna, well, you might not look the same, it might be a boy or a girl. You know, there's nothing I can do about that. You know, because if they show me the ID and they look exactly the same, and they have the same birthday,
Yeah.
there's no way for me to know.
Right.
Yeah.
Fingerprint.
Yeah,
Fingerprint.
Yeah. But see now, here at Harris Health, don't they do like a palm thing?
Yeah,
now?
they do.
Or a fingerprint thing,
Fingerprint.
or a palm thing?
Yeah.
I mean, they're getting smarter.
Yeah.
We're actually entering the information age. Okay. So, whenever we look at the history, we want to get the LMP. And the LMP is what?
Last measure.
And it's when?
First day.
First day that they bled. Okay? Now,
So what is called last menstruation?
So last
because
week-
why do I want
it's the
one
last-
from
yeah,
8
yeah,
months
yeah,
ago?
yeah. From last to the first,
Yeah.
first day, right?
Yeah. And what else am I gonna say? If my LMP is 9/2/19, what's that telling me?
The
Yeah,
first
last
day.
week.
They're on their cycle now. I'm
Yeah,
gonna
it's-
prepare my room differently.
Uh-huh.
I'm gonna make sure I have a chuck underneath them. I'm gonna make sure that I wear a yellow gown. Cause I don't want any of those juices splashing on me. Okay? So this is why. Okay? So, gravida. Gravida means the number of pregnancies. Para, it also means parity. It's the number of term pregnancies. Abortions, whether they're spontaneous or they're electives. When someone says that I have G6, P0, A6. Okay? What is that telling me? I've had 6 pregnancies. I've had no births. I've had 6 abortions.
Oh, wow.
Who said that? Who said that?
Me.
Nope. Can't say anything like that.
Gonna make them cry.
You'll make her cry. It might not have been electives.
She's trying.
She might have had an RH sensitivity to her husband's blood, where she's got pregnant 6 times, but she's lost her baby 6 times. So, smile.
Yeah, it's already.
No, don't show any emotion at all. That's the hardest part about being a sonographer.
So
Is not showing any emotions. Now, I've had them. G13P1.
Oh,
G13P1.
12 abortion.
She was from China.
oh, I know.
During the age where you could only have one child, and they only wanted it to be a boy.
Yeah, that's true.
Okay? When she had to tell me that she had to abort 12 children, she was hysterical. She was hysterical. All I could do was just sit down beside her and hold her. I'm sorry. And I'm emotional. I'm real empathetic. So she was crying, I was crying, we were a mess. But I learned something through that. She was able to instruct me about, well, you know, I came from China, and you know, they only wanted us to have boys, and so I had to abort 12 different times. Okay. They could only have one child,
Yeah.
and it had to be a boy.
Really?
Had to be a boy.
What is the why? So does it go?
It's China, I don't know. I live in America, so, you know.
Is it something?
But see now, here it is 2 decades later, or 3 or 4 decades later, and now there's no women.
Yeah, that's.
So cousins are marrying cousins, and now they're having malformations because of the lineage is too close.
Mm-hmm. Maybe RH. Maybe RH incompatibility.
Yeah, I don't know. Cousins are marrying cousins. So estimated day of delivery or estimated day of confinement are 2 separate things. Like the Vietnamese. Vietnamese believe that after you have a child, that you can't leave the house for a month. You know, because you can't wash your hair. It's unhealthy for them to wash their hair,
No shower.
you know, or shower or anything
1
like
month,
that.
1 month?
So,
Hispanics have weird stuff like
huh?
that.
Has Hispanics had some weird things
My
like that?
mother-in-law would not let me do anything when I just gave birth. I didn't even bend down.
Yeah, isn't that crazy?
Or drive.
Or drive, yeah.
Yeah.
So, you know, different cultures have different things. And we have to kind of learn those cultures from each other.
Mm-hmm.
Because I don't know everybody's culture. I only know what I've learned from my patients or what I've learned from different students, you know? So, but estimated day of delivery, the day that I'm projected to deliver, or the estimated date of confinement when I'm stuck at home. Okay?
Quick question for you, Ms.
Yes.
Sharma. So in the book, it also gives one more term where it actually says term for live births. What's the difference between that and para? Because I didn't really understand.
Parity is if you gave birth to them,
Whether they were alive.
whether they were alive or they were dead. Okay, that includes stillbirths. Okay, that includes stillbirths. Okay, because we're gonna learn that when we get to OB, that it's stillborn after 28 weeks. Then it's considered a stillborn. But now you can have an abortion on your delivery date.
What?
Mm-hmm.